Well, the school year is well underway, which means that your children are out playing sports on the football field, the volleyball court, and everywhere in between. Dr. Ben Spotanic with Pediatric Associates of Savannah joins us now to talk about those fall sports injuries. Good morning, Dr. Ben.
Good morning. Thanks for having me. Congratulations on the new show.
Thank you. You've been a friend of wtoc for many years now, so we're excited to have you today.
Thanks for having me. And it's back to school, so it's also back to sports. And what I was going to share with you today is 3 very common sports injuries we see as pediatricians, sort of an escalation of severity. So the first we see, fairly common, is called Osgood-Schlatter's disease. It's a condition of the front of the shin, the top of the shin right below the knee. We have this great big muscle called the quadricep, and it does a great amount of work, but it inserts into a tiny, tiny point right below your knee. In a child going through puberty, growth spurt, usually around 8 to 14, that growth plate can get very tender.
Oh.
We consider this a mild injury because really they can participate in sports if the pain is controlled.
So it is kind of just growing pain?
It's like a growing pain,
right,
but it's also an overuse injury where the muscle inserts. Ice, rest, ibuprofen, and sometimes they do need to miss a little bit of time from the field, sometimes even a season, but usually no surgery and self-limited.
So do they need to come in and see you for that?
They usually come in to get evaluated, but doesn't usually require much more than sometimes an x-ray and some symptomatic care.
Great.
Second injury, a little more severe. This one's in the shoulder, and this is called a dislocated shoulder. We see this with usually contact, either football or sometimes from a fall, where an outstretched arm can lead to a dislocated shoulder. So your shoulder is a ball and socket joint, and that ball can become dislocated from the socket. Very painful. The athlete will immediately not have good use of their arm. They'll feel pain, they'll feel tingling, and the shoulder, when the trainer or the physician looks at it, will look different. It'll be deformed.
Right.
The treatment is to get it put back in.
Oof.
Not usually on the field. Usually it's done better in the emergency room in a controlled situation by an ER doc or by an orthopedist. And this is not usually season ending, but it's definitely game ending. They'll miss the next week or 2, sometimes longer. The shoulder needs to be immobilized to heal, and then some exercises to help strengthen the joint back up. Usually no surgery involved. X-rays usually. Okay, so I'm going to tell you a third injury. This is a lot more severe. This is called an ACL tear.
Oh, yeah.
Our knee is stabilized by a lot of very important ligaments and tendons. Some go on the outside, but some crisscross in the middle. The ones that crisscross are called the cruciate ligaments, and the front one, or the anterior, is the ACL. This one is susceptible to tear, either by trauma, such as football, but usually from a high-velocity running sport, such as soccer, gymnastics, baseball, where the athlete's going very fast and makes a sudden turn, they will immediately feel a pop.
Snap,
a snap. The athlete will go down. It's very painful. It's diagnosed by suspicion, by immediate exam. The leg will be a little bit more loose than it should be, but ultimately requires advanced imaging, such as MRI, and requires surgery. This is a season-ending injury. It's severe. The athlete will need surgery, will need rehab, and they'll be out for a while. And then a fourth thing I want to mention in our short amount of time is concussions. Concussions are real. Concussions are severe. We learn more every year about the long-term impact of concussions. And what we tell trainers and coaches is, when in doubt, sit them out.
Yeah, just wait.
Just wait. Now, how long? Physicians use a protocol based on symptoms, based on examination, based on sometimes radiology, and based on how many concussions there have been, because we now know that repeated concussions can lead to long-term brain injury, depression, problems with focus, even linked to suicide, so we take these very serious. This was a lot, but I'm going to link everything after this on social media, hashtag WTOC Morning Break for more information. But this is just a small taste of some of the injuries we see throughout the sports season.
Absolutely. And Dr. Ben, you know, fall is finally here. It's starting to feel like fall a little bit. So we're going to be talking soon about the flu season. You're going to come back and see us?
I would love to. Flu season is very important for so many reasons. I would love to.
All right. Thank you so much, Dr. Ben. We appreciate you joining us.
Thank you.
All right. We are going to check